Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, and rating. You can also support future episodes by making small monthly donations. Once again, welcome to the Health Flow Podcast. Welcome to the Health Flow Podcast. This is episode 14, and my guest this week is Dr. Reginald Nesbitt. Our topic this week will be on sexually transmitted diseases. Please excuse any technical difficulties with me. Today, we're going to have a discussion about sexually transmitted diseases. I had a faithful listener that made a request about us just making it plain. So that's what we're going to do today. So, hello, Dr. Nesbitt.
Hello, Jean. How are you doing?
I'm wonderful. I'm wonderful. So yeah, let's just get rid of all these myths that's going on out there about these sexually transmitted disease. First thing, hey, let's just get right in it. Let's talk about gonorrhea and chlamydia.
Okay.
And we always put that together. Explain to the people why gonorrhea and chlamydia go hand in hand.
Well, quite simply, STDs are, what I colloquially would call, out in these streets diseases, um, because they are things that you pick up sometimes when you are kind of, out in these streets. So, not to make too much light of it, but the reason that chlamydia and gonorrhea um, are frequently treated together is because they're frequently transmitted together. It is not uncommon for a person to be co-infected or simultaneously infected with both gonorrhea and chlamydia. So that's one of the dirty little secrets associated with those two sexually transmitted diseases.
All right. So, and you said out in the streets, but really just having multiple sexual partners put you at higher risk for having these sexually transmitted disease. So let's talk about some facts about chlamydia.
Okay. Yeah, like chlamydia, you're right. Most sexually transmitted diseases, as including chlamydia and gonorrhea, and we'll get into the others as well. But they all sort of share a common sort of risk factor pool. Um, One of which being, like you said, multiple sexual partners. Sometimes high risk sexual behaviors such as sex without any sort of protection, and by protection I mean barrier protection in terms of condoms, that allows easy transmission between sexual partners as well. Um, so those are sort of the main two things, and of course you can transmit these diseases through oral sex as well as anal sex, in addition to vaginal sex as well. So all three areas will allow facilitation of transmission of these diseases.
And orally. Did you say that?
Yeah, I said yeah, oral, vaginal, and anal. Absolutely.
All right. So, facts about chlamydia. What are some of the symptoms that a man or woman may or may not have with chlamydia?
Okay, so it's probably useful to separate into men and women. So let's talk about women first. Um, with chlamydia, sometimes women may not be symptomatic, but when they are, they frequently will have the most common presentation is they're going to have a vaginal discharge. The vaginal discharge may have a color, sort of a yellowish or whitish color in nature. Sometimes women also will have um, some pain with the urination as well, some burning with the urination. It's not uncommon for women to have lower abdominal pain, sort of right over the lower area where the lower part of the abdomen where the bladder would reside. That's where people will typically feel discomfort. Uh, those are sort of the main three symptoms that women will exhibit with the initial stages of chlamydia. With men, it's a little bit different. Men will frequently have penile discharge. Now, a man should never, ever, ever have penile discharge at all. Sometimes it can be common for women to have just a normal, what we call physiologic discharge. But for men, you should never have a discharge. Also, men will have burning with urination, and men should never, ever have burning with urination. Particularly a male that is in their over the ages of 2 to 3 years old and between the ages in which you start to have prostate issues, let's just call it in their 50s or so. If you're having burning with urination or you're having penile discharge and you're sexually active, then that places the likelihood of a sexually transmitted disease very, very high for you.
Right. And just to piggyback on what you're saying, we know that chlamydia is known as a silent infection because most people will not have symptoms. And if anyone's going to have symptoms, it's usually men. And their
Right.
symptoms typically are like a mucoid or watery discharge, or they can have burning with urination, feeling uncomfortable in their penile region, if you want to say.
Absolutely, like Eddie Murphy said, and I believe it was wrong. It was peeing fire. Is one of the apt descriptions, particularly with gonorrhea, which we'll talk about a little bit later.
Okay. So, and how do we diagnose and treat chlamydia?
For women, diagnosis is based on the symptoms that they had that we talked about. The burning with urination, sometimes abdominal pain and vaginal discharge. Frequently, that will require a pelvic examination, in which we will inspect the vagina as well as inspect the cervix itself. With inspection of the cervix, you'll see the discharge. You can see the discharge. That will be present. Swabbed samples will be taken. It's not too for women. It would be akin to getting sort of a Pap smear. So you'll get some swabs from the cervix area. Usually is not uncomfortable for that to be done. And those swabs are subsequently sent to a lab, and testing is done. And then whether it's positive or negative, you can usually be informed. For men, same procedure. You will swab the penis with what essentially looks like a Q-tip. Now, in most men, the insertion of anything into the urethra is very painful. So this is not a benign procedure from a pain perspective, but that should not, if a man is having symptoms, the fact that they may, have temporary discomfort with getting diagnosed should not preclude them from going to the physician and getting seen and evaluated. So a Q-tip essentially a Q-tip like device is inserted into the urethra or the part of the penis where the man urinates from, and the discharge sample is subsequently taken and then sent to the lab for similar testing as you would get for a woman.
Right. And nowadays, now we're dating ourselves because what's commonly used and being done to diagnose gonorrhea and chlamydia is just a urine sample
The
now.
urine sample, absolutely. You're absolutely right. Now, if you are at a facility that will that the laboratories have the ability to use urine sample, absolutely you can do that.
Right.
That is not everywhere, so I wanted our listeners to be aware of what particular options that they do have, though. But you're absolutely right. Urine testing is available, and it's actually becoming more widespreadly available.
It really is. But one thing, and I've been working in some facilities that are just relying on that, and I don't necessarily totally, in the spirit of completeness, I still think that just depending on just a urine test sometimes is not enough, because our eyes, what we see, can further diagnose or not diagnose things, and or at least relay the patient's fears. Sometimes just on a basic GYN exam or a male exam, things can be ruled in or ruled out, sort of say. And as we talk about other tests, really a GYN exam is valuable. I don't want us to downplay that. It is important to look and see what's going on down there.
Absolutely. Absolutely.
Okay, so after we diagnose chlamydia, the treatment usually is what?
Usually antibiotics. Chlamydia has basically two antibiotic therapies that you can use a choice of. You can either use a single dose of azithromycin, or you can use a 7-day course of doxycycline.
Right.
That medicine will be taken twice a day.
Right.
Now, it's important to note, if you are, and this goes for both men and women who are being treated, because the treatment is the same. If you are given a single dose of azithromycin, one of the common things that people want to know is, when can I resume sexual activity?
Yes.
If you're taking azithromycin, you want to wait a week until you resume sexual activity. That's for the single dose. If you are prescribed doxycycline, you can proceed after the completion of your medications. Certainly not before, but definitely after the completion, because it will take 7 days of doxycycline to clear your chlamydial infection.
Right.
The other thing that needs to be made is that any partners that you have been active with will need to be treated as well, because it would be a shame for one to get diagnosed and treated and cleared, and then go back to the same partner who has been untreated, and now you've got reinfected again.
Yeah. I'm so glad you brought that up. True story. I've had this happen to me twice last week. I had a woman that came in and she said, I I had sex with someone last night and I want to be tested right now. Um, so I said to her, just in informing, um, you just had sex last night. You may not have developed any symptoms yet. I don't have a problem with doing the test now, but I cannot, in all conscience, say that that's going to be enough, because what if you develop symptoms within 48 hours, within 72 hours, within a week? There's something, transmission time. So
Right.
you can't always just want to, that's a myth, to say that, oh, I had sex with someone last night, I need to know this morning, do I have anything? That's a myth. That
Mm.
is a myth. It just, because I said to her, she's like, the only other person I had sex with was so and so. And so I said, well, if I test you now and you're positive, it doesn't mean that the previous partner didn't transmit that to you. So, let's just hold on a little bit, and just, if you want to just at least wait a little bit, and then I think, in just being complete and, making sure we're accurate here, let's
Yeah.
try it that way.
And this speaks directly to what we talked about at the beginning of the podcast, and in terms of, we have to be, sex is enjoyable like anything else, right? I mean, it's like Lay's potato chips. Once you have it, you're gonna keep doing it, right?
Right.
So but just because it's enjoyable does not mean that we don't need to be cognizant of certain things, and we absolutely have to be careful who we're having sex with. We have to be careful, because if you're, real talk, if and this is not specific to this particular encounter that you had, but this goes to sort of our decision making sometimes. If you are having sex with someone on last night, and you wake up the next morning and you're in a provider's office saying, I think I need to be seen and treated, you might want to reconsider, your sexual behavior or your choice of partners, or how you're deciding who to have sex with and who not to have sex with.
Exactly. You
Because
need
those things go into your sort of your risks for getting sexually transmitted diseases,
exactly.
right?
And that's exactly right, because you hit the nail on the head. It is who she end up having sex with that scared the life out of her. So it was the person. She knew at that moment and by the look on her face that she had made a bad, rash decision. So
Mm-hmm.
yes, that's it. All right, let's move on. Let's talk about gonorrhea. What are the symptoms?
All right, so gonorrhea is a little less silent than chlamydia is. It tends to rear its head. In women, you tend to see a discharge. Usually, the discharge is a greenish yellowish in nature. Frequently is associated with burning with urination, and sometimes you can have some lower abdominal pain associated with that. Um, with men, you will definitely get a green yellow discharge most of the time. And this is a situation in which if you are having burning with urination, it is unquestioned that you are having burning with urination, because it is extremely and exceedingly uncomfortable. And that's where you get the frequent thing is, hey doc, I'm peeing fire here. Uh, so the gonorrhea tends to produce more symptoms than, say, the insidious nature of chlamydia.
Right. And that's hence the reason that why if we treat you for gonorrhea, more than likely you'll be treated for chlamydia, because if you have one, you can have the other.
You can have the other, right?
Treatment for gonorrhea is
So gonorrhea is there is so several years ago we used to have at least 5 to 7 meds that you could use to treat gonorrhea with. To
mhm,
date, we're essentially down to 2, and that is because gonorrhea has had an incredible development of resistance to antibiotics. So now you essentially are down to a medicine called Rocephin, which is an injection, and you're down to azithromycin. Of course, the azithromycin sounds very familiar because that's one of the things that you use to treat chlamydia with. But you're down to essentially this dual therapy, and that is simply because um, gonorrhea has had a remarkable ability to develop resistance to a significant amount of meds that we had previously used to treat them. There are some sections of the country and some sections of the world, actually, to where there is the development of resistance to even these 2 last lines of therapy that we have. That would be tremendously unfortunate if there was a widespread resistance to that, because now you sort of be left holding a bag of how to treat this. Uh,
yeah.
so this goes to um, putting yourself in a lower risk category for getting infected with gonorrhea. So things like using barrier protection, such as condoms. Let's also, by not having sort of frequent sexual partners or frequent sexual encounters with multiple partners, that certainly reduces your risk as well. We're going to see a sort of a theme that develops with all of the sexually transmitted diseases. I may find myself repeating myself the same time over and over: barrier protection, and let's not be out here just having sex with willy-nilly with any and everybody. Yeah.
My mantra is condoms all the time, every time. Condoms all the time, every time. That's how you can nip that in the bud, or no sex at all. But we know.
Right. Yeah. So yeah. I mean, yes, no sex at all, but very few people once you are going to have the discipline to be abstinent. Abstinence, that protects you from everything. But you're absolutely right. Condoms all the time, every time, because not only are you preventing your exposure to sexually transmitted diseases, you're also reducing your odds of getting pregnant. And if you find yourself, and this is where this is another reason you really, really got to be careful who you're having sex with, because I mean, don't get it twisted. Sex is as enjoyable as anything, and most adults like to have sex like anybody else. But there are ramifications to it if we don't have a heady approach to it. And as sexually transmitted diseases are one, and pregnancies can be another. And if you find yourself in a situation having sex with someone, I basically tell people this all the time. If you are unwilling to raise a child with the person that you're having sex with, you probably shouldn't be having sex with them, because there is a risk that you're going to get pregnant.
There is
Period.
a period. And we need to really talk about this too, because it goes hand in hand. The people that are having the most sexually transmitted diseases are teenagers and young adults.
Right.
And that is a fertile moment and time in a woman's lifespan. So you're the most fertile then in your teenage and 20 years old, in your 20s. And then you're having not necessarily more sex, but probably more partners. And here it is, pregnancy, STDs.
Right, and absolutely, and we've all been there. I mean, I'm certainly a different person as an adult than I was in my teenage and college years. I mean, I make much better decisions now than I did then, and it's sort of the natural development in the cycle of life. And but that doesn't preclude us from making the best decision. And this is where education comes into play, because you want people to make informed decisions. If you don't inform them, then they'll make a decision. Now, the outcome may not be what they want it to be, but they'll make a decision.
And
And speaking of fertility, you're absolutely right. But one of the things that can happen, particularly with gonorrhea and with chlamydia in women, if they go untreated, is that it has the potential to they have the potential to develop something called pelvic inflammatory disease, in which you get massive infection and inflammation in the pelvic region, particularly around the woman's reproductive organs, mainly their fallopian tubes and their ovaries. And it can cause a massive amount of scarring, which can later in their reproductive years make it very difficult, if not impossible, for them to get pregnant.
absolutely.
So decisions that we make when we're younger can come back to haunt us when we're a little bit more mature and a different stage in life. And that's no different from any other decision that we make, though.
Absolutely. Absolutely. So let's move on. So we've only touched on gonorrhea, chlamydia. Let's talk about genital herpes. Well, let's talk about herpes. We're going to divide herpes into herpes simplex 1 and herpes simplex 2, which is the genital herpes.
Right.
So, yeah, there's lots of, earlier in our conversation, I was sharing with you how I had a faithful listener who she was concerned about. I mean, in all actuality, this is what she said. She's like, if I ever saw anyone that had a fever blister, I automatically thought that's because they were engaged in oral sex. And then when she had a daughter and the infant was maybe around 6 months old, she said the daughter told her that her child had herpes of the mouth, and she just at 6 months she was just distraught and just not trusting that physician, because she knew it was impossible for her daughter to have herpes. Can we just like break those two apart? Remove the myth and the fallacy and clear this up right now.
Sure. Okay, so when it comes to herpes, you have essentially two broad types. Herpes simplex 1 or HSV 1, and then you have herpes simplex 2 or HSV 2.
Yes.
HSV 1 most commonly causes fever blisters. And most of our listeners know what a fever blister is. Tingling, a little bit of burning, and then all of a sudden you've got this sore that's on the lip, the corner of the mouth, and it's there for several days. It crusts over and then it goes away. And this can be a repetitive cycle. That's caused by herpes simplex 1. Has nothing to do with getting
Sexually.
it necessarily getting it from sex.
Right.
However, let's talk about herpes simplex 2, and then I'm going to come back to simplex 1.
Well,
Herpes
before you go to herpes simplex 2, I just want to say any so with children, it's very common in children.
right.
Touching of their mouth, the oral fluids,
Mhm.
that's how they get it.
Right.
You know, and who is more runny mouth when they're teething and
Yes.
all of that children. So
Right.
just want to the mucosa. I just want to mention that for and kissing, of course, but go
Yes.
ahead with genital herpes.
Yeah. And one thing to add to that is that, a person can transmit a fever blister, herpes infection, until it completely is crusted over, until it's clear. As long as it's open and weeping, you can give a fever blister to someone else. Now, when it comes to herpes simplex 2 or genital herpes, which most people associate with a herpes infection, that's caused by herpes simplex 2. This is a true sexually transmitted disease. Can be translated oral sex, can be transmitted anal sex, can be transmitted by vaginal sex. All three, just like gonorrhea, just like chlamydia. Um, Symptoms, we'll break it down into men and women. Men will have ulcers, very painful ulcers that can be present anywhere that there was point of contact on the penis. So anywhere along the penis, could be also on the testicles as well. But the commonality is a very, very painful, I cannot stress painful,
Right.
painful ulceration that is present. You can also have burning with urination. Women, on the other hand, have a more sort of a more fulminant presentation. They will get burning with urination that is very, very intense. Um, I've been told it feels like razor blade. They're like someone is urinating or peeing razor blades. The other thing is that women too, will also have ulcers that are present in the vaginal area, and that can be um, particularly for a first outbreak, can be widespread. So it can be throughout the vagina on the exterior surfaces of the vagina. It can get down in between the areas between the vagina and the anus. And there can be multiple, and there's a lot of discharge, a little grayish discharge, and lots of pain. It's very, very painful for a woman to have herpes simplex outbreak. Now, what is true of both men and women is subsequent outbreaks may not be as bad as the first outbreak,
The initial, right.
okay, as the initial outbreak. But that initial outbreak in most people, very painful, very bad, very apparent. But subsequent outbreaks may not be as bad. However, that does not mean that you cannot transmit this virus to someone else because your outbreaks are not as bad.
Right.
And that's sort of the key that we have to talk about. As far as treatment, the treatment is going to be the same in both. You can either be treated with a medicine called acyclovir up
Right.
to 5 times a day, or you can be treated with a medicine called valacyclovir. They're both in the same family. And you can be treated twice a day with that for about a week or so. Now, that being said, these are not cheap treatments. And more importantly, here's the thing. Whereas treatment of chlamydia and gonorrhea results in eradication or cure of that particular disease, herpes, what you do is you suppress the outbreak, you shorten the outbreak, and it goes dormant again, but you never truly clear it from
Right.
the body. And that's the key that people need to understand, which is why you can have a initial outbreak and then a second outbreak and a third outbreak. The medication does not eradicate the virus that causes it. It simply shortens the course and suppresses it and then allows healing and facilitation of getting your tissues back to normal.
But
But
you can always test positive for, once you've had the herpes virus, you more than likely will always test positive for it, even if you don't have any future or further outbreaks.
correct, because it will always be there. It's just, it's one of the sayings that we say in medicine. It's one of the gifts that just keeps on giving,
And
right?
actually, I don't, and I might not be clear of it. Do you have to actually have symptoms during the time, like it's contact? So do
Mhm,
you have to, if a person tests positive for for herpes, HSV2, the genital sexually transmitted,
mhm.
and they're not having an outbreak, but they have unprotected sex with someone else,
Hmm.
does that mean that they can then transfer it just by the act, or the fact that they've had it before, or do they need to be having an outbreak to then transfer it? Do you
Great,
see what I'm
great,
saying?
absolutely great question. Great question. Um, the simple answer is no. You can have, you don't necessarily have to have an active outbreak, in order for you to transmit the virus to someone else. You would have to have a tremendous desire to have sex when you have an herpetic outbreak, because you don't even want to use the restroom, right? Let
Right.
alone participating in something
Mhm.
as vigorous as sex can be. That would be extremely painful. But you don't necessarily have to have an outbreak to transmit it. There is
Right.
a process called viral shedding, in
Hmm.
which a person, the virus is replicating itself. You may not necessarily have an outbreak symptoms, but if you are in that period of viral shedding, then you will certainly raise the risk of transmitting herpes to someone else.
Right.
And
And
it is incumbent upon someone who has been diagnosed and treated with herpes to be upfront with any future sexual partners to let them know they've been affected. And that's where, again, barrier protection comes into play,
right.
condoms, and
Ex-
in not having multiple partners as well.
exactly. Exactly. And
Yep.
that's almost verbatim of what the CDC says. Actually, they say transmission of genital herpes commonly occurs from contact with an infected partner who does not have visible lesions and who may not know that he or she is infected.
Correct.
I mean, verbatim.
Yep, that's the viral shed. That's the symptoms of sort. That's the transmission of viral shedding. Now, one other thing about herpes simplex. Now, if a person has, and this is very important, a practical point for our listeners,
Mhm.
if a person has a fever blister, which is HSV1, okay, and you engage in oral sex with someone, that herpes simplex can infect a person's genitalia, penis and vagina, and
Right.
cause a herpetic and a genital herpetic outbreak.
Right.
So if you have a fever blister, let's not be out here, participating in oral sex, knowing that you have this, because you can take what is essentially a benign illness of your lips and your mouth and turn it into a lifetime of genital infection for someone else.
Right. Right. Exactly. Exactly. Even with that said, we got to keep it moving. Let's keep it moving. Let's talk about now trichomonas.
Okay.
Trichomonas. What is trichomonas?
Trichomonas is another STD. It is sufficiently common as well. It is transmitted by, sexual contact,
Yep.
just as the others are as well.
Mhm.
It is can produce symptoms in both men and women. A little bit less, and it's a little bit less aggressive in terms of its symptom development. But common things can be vaginal discharge, mostly in women, and you can have some little bit of discharge in men.
Mhm.
Or sometimes you can have some itching as well. That may not be as common. For women, you get diagnosed with a pelvic examination, and you have swabs that are done, or you can do a urine test quite simply, and you can actually see the trichomonas in the urine.
Right. Just to interrupt you, everybody out there, the trichomonas is a parasite.
Yeah,
It's
absolutely.
a parasite that's transferred from one infected person to the other during sex. It is a parasite. You could actually, how do we diagnose it by looking under them, doing a wet mount and looking and seeing that specific parasite. I think lots of ERs still do that.
Yeah, absolutely. Just, and like I said, you can see it in the urine. And sometimes what will happen, because you can be asymptomatic with the trichomonas, and a person may be coming in and you're doing a urine sample looking for a urinary tract infection, and you see the trichomonads in the urine, and
Exactly.
they subsequently can be treated from that.
And it takes 5 to 28 days. This is what the CDC says, that it takes 5 to 28 days after being infected for you to even have symptoms or be diagnosed with it.
Correct. Correct.
It's not immediate. Oh, next morning, let me go test.
That's right. That's right. That's so choose your partner as well. Uh,
Exactly. We're back to that theme
we're
again.
back to that again.
Yes, yes, yes. And how do we treat trichomonas?
We treat trichomonas simply with medicine called metronidazole,
Mhm.
um, and that's both for men and for women. Now, one of the keys about whenever a person is taking metronidazole is you absolutely cannot drink any alcohol with it, because you will have a violent reaction with it.
Mhm.
So a little practical tip for our listeners with that.
Yes, and metronidazole, as we're going to talk next about bacterial vaginosis, and it's also used to treat BV, bacterial vaginosis. And I think, I guess the whole reaction is more serious with alcohol, but I've even seen, some people talk about also cheese,
Yeah,
right?
yeah, yeah, absolutely. It is a more severe reaction with alcohol, but it also can happen with cheese. And the reason behind that is because it's very similar, without getting too nerdy here, but it's very similar in structure to a medicine that was once used to treat alcoholism. And you would give, it's called antabuse, and you would give it to alcoholics, and if they were to drink at all, they would have such a violent reaction, it would curb their desires for the consumption of alcohol.
Mm-hmm.
So that's
Right.
where that comes from.
And next thing we'll talk about, like I said, is bacterial vaginosis. And even though bacterial vaginosis is not necessarily a sexually transmitted disease, it's not, but having multiple partners and unprotected sex can actually, assist and aid in a woman getting bacterial vaginosis, because this is specific to women.
Were you trying to say aid and abetting?
I really was.
We're doing some SBU right now.
Don't tell on me. That's one of my favorite shows. But yes, so bacterial vaginosis is common vaginal infection in women ages 15 to 44. Um, Having a new sex partner or multiple sex partners, as well as douching.
Yes.
Don't douche. What it does is just upset the balance of bacteria in the vagina, and then you have an overgrowth of the bad bacteria. That's what we don't want. And women will have symptoms such as itching, um, fishy odor, strong fishy odor. Um, those are really, and you can have the dysuria too, the burning with urination,
Yeah,
um,
sometimes you have some dysuria, and you'll frequently women will notice sort of a grayish
discharge.
discharge. Yeah, a grayish colored discharge. With the prominent symptoms will definitely be the fish. You'll have some mackerel, some salmon action going on for sure, um, and it will uncooked and left out salmon and mackerel action going on. Um, and and for certain, most women will have some of that sort of that grayish discharge. You can have a little bit of that itching as well. But you're right; it's not so much a sexually transmitted disease itself. Meaning that if a woman is diagnosed with bacterial vaginosis by the pelvic exam and by their physicians, it does not necessarily. This is where it sort of forks in the road, and
Yeah.
a woman who has been diagnosed with bacterial vaginosis, their partner does not necessarily have to be treated.
Right, right. And misconceptions. You cannot get BV from toilet seats. You
No,
cannot get BV from bedding or swimming pools. Actually, you can't get any STDs that way from bedding, toilet seats. You actually have to have sex.
yeah,
Okay.
gotta have some close contact going on, right?
Yes, yes, yes.
That's
Um,
contact.
You definitely do. And if you are, it is treated, like we said, with the metronidazole or flagyl.
Yeah,
That another thing that women may know, that's it tastes horrible. I warn people about that. Never to drink, and really, that's it. Just complete it. I've even known women who say certain foods trigger their BV.
yeah,
For whatever reason, throw their natural flora off balance, and then they get it. So it's not specifically a STD, but if you're having sex, you a new partner, you're now introduced to new bacterias and multiple partners. It increases your chance to get bacterial vaginosis.
absolutely. And one thing one little hidden gem in there that you said is you want to make sure, and this goes for all of your treatment courses for any sexually transmitted disease. You want to make sure that you complete all of the antibiotics. What may happen is during the treatment phase with the antibiotics, you may start to feel better, right? You may start to feel better. Your symptoms may improve as the combination of your body's immune system and the antibiotics working in concert to eradicate the illness, save herpes.
Right.
Um, you may feel like, oh, you know what? I'm better. I don't need to finish this. Wrong, wrong, wrong. Finish it all. Finish the entire course. There, you are giving a specific treatment course timeline for a reason.
Right.
Okay, take them all and take them on time.
Oh my goodness, you just said something. I mean, I can go back to this week alone, having conversations with people who feel like, evidently we just like make it up or just put antibiotics in a hat and say, "Oh, I'll use this one today. I'll use that one." I had a conversation with this woman because she was arguing me down about 3 days of Bactrim for UTI. In her mind, that's not enough. Like, I need to be taking this at least 7 days or 10 days. No, back antibiotics. There's like we do use scientific knowledge about what bacteria is specific, what antibiotic is specific for certain bacterias, and
Right.
that's how you decide. It's not guesswork. I mean, it's not 3 days, 5 days, 7 days, 10 days just because we want to. It is what's been proven. So just
Yes.
keep
Yeah.
that in mind.
My own mother likes to argue me down because it's like, well, that's only 5 milligrams. My friend is taking something that's 200 milligrams. I feel like I should be taking more milligrams. No, you don't. Like
Yeah.
that. There's no correlation to what you're talking about.
All right.
Stop.
Stop it. All right. Let's keep it moving here. Let's keep it moving. Let's talk about the big one. HIV and HIV,
Okay.
the big one. How is it? How do we get it? And how are we treating it? How can we prevent transmission?
Okay. So it's been an evolution of HIV since I was a young child when it first started sort of hitting the scenes in the late 70s or in early 80s. And fortunately, through advances in science and through an education, we've seen some really large changes in the treatment of HIV, the public perception and impression of those who are diagnosed with HIV, and quite frankly, the longevity of people who have HIV, which is I think are all good things. Transmitted through sexual contact, oral, anal. It's also a blood-borne pathogen, so sharing needles if you are a drug user. All of these things put you at risk for exposure to HIV.
Right.
So ways to protect yourselves: condoms all day, every day. Limit the number of partners and limit your high risk behaviors. And I understand that, look, people have problems. I understand. I get it. Like, I'm not insensitive to the fact. And drugs can be intravenous use of drugs, heroin, methamphetamines, or whatever your drug of choice is. These things happen. And I'm not going to begrudge and belittle people who have their own issues, because we all have our own issues. However, I will say this: while I'm not advocating that anyone go out and use heroin and methamphetamines or any other injectable form of drugs, I will say this: if you choose that particular lifestyle, be safe with it. Use your own needles. Don't share needles, because that puts you at risk for transmission of diseases like HIV and certain forms of hepatitis.
Yes, absolutely. And I was men who have sex with men.
Mhm.
Why are they at a higher risk for having HIV?
Well, you have men that have sex with men, because of sort of uh, the route of anal penetration, that with men who have sex with men, that puts them at a little bit of higher risk. You can get small microscopic anal tears. The anus has a lot of blood flow that goes to it, so it makes it very easy to transmit the virus in that fashion.
And not only with that saying, though, a man who has anal sex with a woman, and
Mhm.
if he's infected, it's the same thing that
It's the
they
same.
are at a higher risk for
Absolutely.
transmission to having anal sex. That's the point I was just trying to get to. I mean, just know what you're doing. No one's telling, we're not encroaching on anyone's lifestyle.
Not
You are
tell, right. Not trying to tell you what to do. Not even trying to tell you how to do it. We're just saying,
exactly.
be safe when you do it.
Be safe when you do it and be aware.
Be
Like,
aware.
knowledge is power. Like,
Mhm.
know what you're going into, and actually know it before you start having sex.
Mhm.
Be empowered and be informed.
Be informed.
Know about all this stuff so you can make, like, Dr. Nesbitt says, you can make proper decisions, adult decisions.
That's right. You out here doing adult things. You gotta make adult decisions that go with them.
Exactly. All right. So we talked about HIV and AIDS. Let's talk about syphilis.
Well, let me give you one thing about HIV, because you mentioned HIV, but there's a differentiation between HIV and AIDS,
Yes,
and
there, there
this is
is.
probably useful for our listeners as well.
Yes.
HIV is you have so the way HIV is, it's a very little it's an ingenious sort of virus. It basically, think of, okay, let's say that you have some people that are coming to rob your house, right? And you have security guards, okay? But you have a central security guard that you have to call to activate the rest of the security guards, right? So if you see somebody coming onto your property, the other security guards who protect your property will not kind of jump into action unless they are told. And so you make the phone call to the central security guard, and then the central security guard says, "Hey guys, look, there's some unsavory action that's about to go on this property. We need you guys to go out here and take care of it." So your security guards go out. They find the person, beat them down, arrest them, and you're good. What HIV does is it prevents the central security guard from ever getting informed that something is there. Therefore, you've got protection in the form of your other sort of policing security guards, but they never go into action because they're never told that something is there. And that's sort of the way that HIV works. And it systematically takes down your immune system one by one. And things that you would normally get exposed to and never get infected by, now you start to have infections from rare things that you should never get. So
Right.
that's HIV. The difference between HIV and AIDS is when enough of the central security guards have been taken down, the central guys, the guys that make the call to the people on the ground that help fight off things. When you take out enough of them and their numbers dwindle below a certain critical point, then that's what AIDS is. Okay, so the central security guard in your body is called a T cell, and when your T cells drop below a certain number, and that number is known, then that is when you develop AIDS, because now you essentially have no immunity whatsoever.
Not
And
mounting any defense.
yeah, without any defense. So with HIV infection in and of itself, you can still mount defenses to certain things.
Right.
Most to a lot of things. But with AIDS, your ability to mount defense, because you've taken out that sort of that central security guy, you have no defense whatsoever.
Right. Absolutely.
Which is why it's very, very important that if you get diagnosed, treatment is paramount. And I won't go in depth about the treatment because there are a multitude and varied amounts of medicines, the very complex medication regimen that sometimes can be had. But I will suffice to say this: if you have been diagnosed with HIV, it is paramount that you continue to follow up with your physician and follow your physician's treatment plan for you. A. B, it is incumbent upon you to make adult decisions and make sure that if you're going to be in a relationship with anyone, that they know. C, if they do know and you choose to have consensual sex with each other, barrier protection is important. Or
Yes.
D, if you know you've got HIV, you can't be sharing needles out here in these streets.
Right. Absolutely. And let me just, I might be dating myself, but let me just say I worked initially with HIV patients back in the 80s, and we specifically had an HIV floor. Everyone that had HIV then progressed on to having AIDS and all eventually die. You could see them by the texture of their hair, how thin they were. We were able to diagnose people with HIV before even doing a test. We've come a long way. I mean, treatment is so specific now. Heck, we can prevent HIV in children, transmission from mother to baby. Nowadays, there's cocktails of treatment that you could take that if you've had a high risk behavior, you could potentially prevent yourself from getting HIV.
Right.
We've come a long way. Treatment has really, people are living 10, 20 years after diagnosis. And just famous people, I'm talking about just everyday Joe Blow who is just taking good care of himself, seeing his doctor regularly, and taking the medicines he's prescribed, and not having high risk behaviors. Because if some things, two HIV people, it is still not okay for two HIV persons to have unprotected sex. because the virus is still, reacts different in their body, and you just don't do that. So that's not safe. And just to put out there, look, if you're going around and you have HIV and you're having knowingly having unprotected sex with people without informing them, that is also a criminal offense, because I've seen that too. So
Yes, absolutely.
just want to get that out. All right, let's talk about syphilis. We've got like about 6 more minutes.
Okay. Okay.
All right, so syphilis, used to be, way back then, but it has shown up again in our population. One, two, because of, in the community of men who have sex with men, men who's, or men or women who's HIV. Let's just refresh people's memories or just give them the information about syphilis, and is and how it can easily be missed, stage one, and then stage two, and then stage three.
Sure. So syphilis, used to be I mean, it's like I said, it was a very common sexually transmitted disease, and you, of course, get it in the same ways, anal and vaginal penetration as well. It is easily treated.
Yeah.
Okay, it is easily treated. The problem becomes in the diagnosis, and that is because syphilis has essentially four stages. Uh, the first stage is what we call primary syphilis, and that's where the initial site of infection occurs. You will have what is called a chancre sore, and it is an ulcerated lesion that can be present on the penis of a man or somewhere on the vulva or the vagina, usually in the vulva or vagina of the woman. The problem is it's painless. So
Yeah.
it's very easy for a patient to completely miss it. Now, if a man, it's a little less easy to miss, unless it's on the underside of the penis, where not many men are inspecting the underside of their penis, right? But it's a painless ulcerated lesion that hangs out, and it's there for a couple of weeks, and that's initially the initial site of exposure to syphilis. If that goes untreated, the chancre goes away, completely goes away. And then you proceed to the second stage of syphilis several weeks later, which is secondary syphilis. Syphilis is often called the great mimicker because it mimics a lot of different diseases. And it's very easy to misdiagnose someone who is in the second stage of syphilis because it can look like other things. And that's why we have to be vigilant when we see. But one of the most common presentations a patient can have is a rash that involves the hands and the palms of the hand, the soles of the feet, or it could be anywhere on the trunk of the body. Frequently, the rash does not itch. You can have a ton of lymph nodes in your body that suddenly become reactive. And sometimes you get a fever, but most of the times you actually don't. Again, just like primary syphilis, if this is untreated, it goes away. And then you enter what's called the latent phase, where you can just hang out and have no symptoms for years. For years. And then you have finally the last stage, which is tertiary syphilis. And this is the debilitating form of syphilis that can occur if it is untreated, because the particular spirochete, or bacteria spirochete is what it is, Treponema pallidum, that has the ability to affect the eyes, the nervous system, the heart, and the blood vessels, and can cause very debilitating diseases up to a person can be paralyzed from tertiary syphilis. So those are the main stages. Now, that being said, syphilis is treatable. And it's treatable not by some super complex antibiotic, it's treatable by penicillin.
Yeah.
Just regular
Penicillin.
right? Just penicillin. Now, it has to be specific forms of penicillin, which requires an injection. Not that we're not talking about oral penicillin. We're talking about in the injectable form of benzathine penicillin. But it's readily available. It's readily available in offices. It's readily available in hospitals. It's readily available in the health departments in many communities. So it's super treatable, but you have to be aware of symptoms that you have. So it's incumbent upon the patient. If you have any of these things, what you want to do is you want to get treatment before you hit that latent phase. You want to get treatment before you hit that latent phase, and things can go undetected for a while, and then you end up having more serious disease, more serious manifestations of the disease later on.
Okay.
Yep.
All right. Oh my goodness. Only other thing else that I really had was pubic lice, scabies, mites. And just to remind you, all this information that we've talked about can be found on CDC. The CDC has fact sheets about all this information and it's presented in a way that you can understand. Just remember, the causes for STDs is just sexual intercourse with an infected person, sharing sex toys with an infected person, sharing needles, having intimate contact with the genitals, mouth, or rectal areas of an infected person, and just exposure also to infected body fluids during birth. And I mean, we could just go on and on. We hope you found all this informative. I'll have information on the episode notes, and you can contact me and we'll give you those information. Thank you so much, Dr. Nesbitt, for sharing with your girl. I appreciate you.
Thank you. It was my pleasure. Oh, and one thing, Gene, I know we talked about this on our last interview together. Uh, Mr. X came back to the emergency department, the gentleman who was missing dialysis, and he was not there for that this time. And I walked into the room. He says, "Hey, man, I'm not here for that. I've been going to dialysis. I learned everything you told me. I'm going to dialysis every week. Just wanted to give you an update."
So you out there making a difference as usual. Thank you. Appreciate you.
All right. Thank you.
Thank you for listening to the Health Flow podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram at thehealthflow, also on Facebook at The Health Flow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.